Which part of the nervous system is responsible for the rest and digest response? Option A, sympathetic nervous system. Option B, central nervous system. Option C, parasympathetic nervous system. Option D, somatic nervous system. So the answer is C, parasympathetic nervous. Which is the primary function of the lymphatic system? Option A, circulating blood to all parts of the body. Option B, fighting infections and maintaining fluid balance. Option C, digestion and absorption of nutrients. Option D, producing hormones. Option B, fighting infections and maintaining fluid balance. Which of the following is a retrovirus that attacks the body's immune system? Option A, human papilloma virus. Option B, influenza virus. Option C, human immunodeficiency virus. Option D, hepatitis B virus. C is the correct answer. What is the most common route of drug administration for immediate and complete absorption? Option A, oral. Option B, subcutaneous. Option C, intramuscular. Option D, intravenous. So intravenous is the correct. 5. The enzyme amylase is responsible for breaking down which nutrient? Option A, proteins. Option B, fats. Option C, carbohydrates. Option D, nucleic acid. Amylase, so the answer is the carbohydrate. Which of the following vitamins is a component of the B complex group and is crucial for red blood cell formation? Option A, vitamin A. Option B, vitamin B12, cobalamin. Option C, vitamin C. Option D, vitamin E. B12, cobalamin is the right answer. What is the term for a sudden, severe and rapid onset of a disease or condition? Option A, chronic. Option B, acute. Option C, remission. Option D, recurrence. Acute is the correct. The psychological concept of Maslow's hierarchy of needs suggests that which of the following needs must be met first? Option A, safety needs. Option B, self-actualization. Option C, physiological needs. Option D, esteem needs. So the C, physiological needs is correct. Which of the following is an example of active immunity? Option A, receiving antibodies from a mother's breast milk. Option B, getting a vaccination. Option C, receiving a blood transfusion. Option D, a shot of tetanus antitoxin. So the B, getting a vaccination is correct. In sociology, what does the term social stratification refer to? Option A, the process of moving from one social class to another. Option B, the division of a society into a hierarchy of layers or classes. Option C, the study of social norms. Option D, the process of social change. B is the correct answer. What is the primary cause of an inflammatory response in the body? Option A, hormonal balance. Option B, reaction to injury or infection. Option C, lack of nutrition. Option D, genetic predisposition. So B is the correct answer. 12. Which of the following is a symptom of a Cushing syndrome? Option A, unexplained weight loss. Option B, high blood pressure and weight gain in the upper body. Option C, low blood pressure. Option D, decreased appetite. So the B is the correct answer. What is the term for the study of the effects of drugs on the body, including their mechanism of action? Option A, pharmacokinetics. Option B, pharmacodynamics. Option C, toxicology. Option D, therapeutics. So the B, pharmacodynamics is the correct. Which part of the eye is responsible for focusing light onto the retina? Option A, iris. Option B, cornea. Option C, lens. Option D, pupil. So the C, lens is the correct. What is the primary cause of anemia? Option A, high red blood cell count. Option B, low iron levels in the blood. Option C, high blood pressure. Option D, high blood sugar. So the B, low iron levels in the blood. Which of the following is a modifiable risk factor for heart disease? Option A, family history. Option B, age. Option C, smoking. Option D, gender. So the smoking is the correct. The sociological concept of social roles refers to option of the person's position in a social group. Option B, the behavior expected of an individual who occupies a given social position. Option C, the process of social change. Option D, the study of social behavior. So B is the correct. What is the primary role of the pancreas in regulating blood sugar? Option A, promoting insulin and glycogen. Option B, filtering waste from the blood. Option C, storing glycogen. Option D, absorbing glucose from the blood. A is the correct answer. Which of the following is the largest endocrine gland in the human body? Option A, pituitary gland. Option B, adrenal gland. Option C, thyroid. And option D, pancreas. Largest endocrine, so the thyroid is the correct. Which is a cultural shock? The experience of moving to a new country. Option B, a feeling of confusion, anxiety or disorientation when experiencing a new culture. Option C, a form of entertainment. Option D, a type of social norm. So the B is the correct. Part B, nursing subjects. What is the primary goal of the nursing diagnosis? Risk for infection. Option A, to prevent the patient from getting a fever. Option B, to identify and prevent potential sources of infection. Option C, to administer antibiotics to the patient. Option D, to encourage the patient to be in crowded room. B is the correct answer. Which nursing intervention is most appropriate for a patient with a wound dehiscence? Option A, encouraging the patient to cough and laugh. Option B, applying a sterile saline soaked dressing to the wound. Option C, using a non-sterile dressing. Option D, giving the patient a high fat diet. B is the correct. What is the primary purpose of a fluid balance chart? Option A, to monitor a patient's diet. Option B, to measure the patient's daily fluid intake and output. Option C, to document the patient's medication. Option D, to assess the patient's mobility. So the B is the correct. Which of the following is a key symptom of a septic shock? Option A, low blood pressure and an increased heart rate. Option B, high blood pressure and a decreased heart rate. Option C, a slow and steady heartbeat. Option D, a sudden increase in body temperature. So A is the correct. 25. What is the primary nursing intervention for a patient experiencing severe pain after surgery? Option A, telling the patient to ignore the pain. Option B, providing scheduled pain medication as prescribed. Option C, giving the patient a glass of water. Option D, encourage the patient to be in a noisy. Which of the following is a key sign of a newborn experiencing jaundice? Option A, bluish skin color. Option B, yellowish skin and eyes. Option C, pale skin. Option D, a rash. Option B is the correct. What is the primary goal of a well child visit in pediatrics? Option A, to treat acute illnesses. Option B, to administer vaccines only. Option C, to assess growth and development and provide preventive care. Option D, to perform a psychological evaluation. C is the correct. In psychiatric nursing, what is the term for a patient's irrational and intense fear of a specific object or situation? Option A, delusion. Option B, hallucination. Option C, phobia. Option D, mania. C is the correct. What is the most important nursing intervention for a patient who is experiencing a panic attack? Option A, to leave the patient alone. Option B, to provide a calm and quiet environment and use therapeutic communication. Option C, to tell the patient to calm down. Option D, to administer a high dose sedative. Option B is the correct. Which of the following is a common side effect of antipsychotic medication? Option A, increased appetite and weight gain. Option B, decreased appetite. Option C, sudden weight loss. Option D, a rash on the skin. So A is the correct. What is the most important nursing intervention for a patient who is a flight risk? Option A, placing the patient in a quiet room. Option B, placing the patient in a room with a window. Option C, providing a safe environment and monitoring the patient closely. Option D, encouraging the patient to take a walk. C is the correct. In obstetric nursing, what is the purpose of a fetal monitoring device? Option A, to measure the mother's blood pressure. Option B, to measure the baby's weight. Option C, to assess the fetal heart rate and uterine contraction. Option D, to determine the baby's gender. So the C is the correct. What is the primary role of a nurse during the first stage of labor? To push the baby out, B, to monitor the mother's and fetus vital signs and provide comfort measures, C, to administer a C-section, D, to provide a new diet plan. So the B is the appropriate. Which of the following is a key sign of postpartum hemorrhage? Option A, slight increase in blood pressure. Option B, excessive vaginal bleeding and a sudden drop in blood pressure. Option C, a gradual onset of a headache. Option D, a sudden increase in body temperature. So the B is the correct answer. What is the main purpose of breastfeeding for a newborn? Option A, to provide nutrients and passive immunity to the baby. Option B, to help the baby sleep. Option C, to prevent the baby from getting a cold. Option D, to help the baby with mobility. Option A is the correct. 36. In community health nursing, what is the purpose of health education? Option A, to treat a disease. Option B, to provide information and skills to help individuals make informed decisions about their health. Option C, to provide a list of medications to the community. Option D, to manage a chronic disease. So B is the correct answer. What is the primary role of a community health nurse during a home health visit? Option A, to provide an in-depth psychological evaluation. Option B, to provide medical care and monitor the patient's condition in their home setting. Option C, to give the patient a new diet plan. Option D, to perform surgery on the patient. So B is the correct. 38. Which of the following is a key sign of a patient with dehydration? Option A, increased urination and moist skin. Option B, dry mucous membrane and decreased urine output. Option C, swelling in the feet. Option D, unexplained weight gain. So, dehydration, which means dryness and decreased. So the B is the correct. 39. What is the main purpose of pain assessment in nursing? To determine if the patient is lying about their pain. Option B, to assess the patient's pain level and guide pain management intervention. Option C, to give the patient a sedative. Option D, to ignore the patient's pain. So the B is the correct, to assess the patient's pain level and guide pain management interventions. 40. What is this SBAR communication tool used for in nursing? A, document patient vital sign. B, to effectively communicate patient informations to other healthcare professionals. Option C, to administer medications. Option D, to perform a psychological evaluation. So B is the correct. What is the purpose of a pulse oximeter? We all know that, but here are some options. Option A, to measure the patient's heart rate. Option B, to measure the patient's blood pressure. Option C, to measure the oxygen saturation of the blood. Option D, to measure the patient's body temperature. So C is the correct answer. 42. What is the primary purpose of a surgical consent form? Option A, to give the nurse permission to perform surgery. Option B, to ensure the patient has given informed consent for a medical procedure. Option C, to document the patient's diet. Option D, to provide a list of medication. So the B, to ensure the patient has given informed consent for a medical procedure. 43. Which of the following is a common symptom of a urinary tract infection, means UTI? Option A, unexplained weight loss. Option B, pain or burning during urination. Option C, a sudden drop in body temperature. Option D, a severe headache. So B is the correct. 44. What is the most important nursing intervention for a patient who is post-surgery? Option A, encouraging the patient to lie down for an extended period. Option B, monitoring for signs of infection, bleeding and pain. Option C, giving the patient a high-fat diet. Option D, notifying the family of the surgery. So B is the correct answer. 45. What is the Glasgow Coma scale used to assess? Option A, the patient's pain level. Option B, the patient's level of consciousness. Option C, the patient's nutritional status. Option D, the patient's risk for falls. So B is the correct. 46. What is the primary role of a pediatric nurse in a patient with a cough and cold? Option A, to give the child a cold compress. Option B, to monitor the child's respiratory status and provide comfort measures. Option C, to tell the patients not to worry. Option D, to administer an antibiotic. B is the correct answer. What is the main purpose of discharge planning in nursing? Option A, to decide when a patient can leave the hospital. Option B, to provide a seamless transition of care for the patient from the hospital to their home or another facility. Option C, to tell the patient's family about their diagnosis. Option D, to provide a list of medications to the patient. So B is the correct answer. 48. What is the most important nursing intervention for a patient with a low blood pressure, hypotension? Placing the patient in a semi-Fowler's position. Option B, elevating the patient's feet to promote blood flow to the head and heart. Option C, giving the patient a cold bath. Option D, administering a high-dose sedative. B is the appropriate answer. 49. What is the universal precautions principle in nursing? Option A, to use sterile gloves for all procedures. Option B, to treat all patients' blood, body fluids and secretions as potentially infectious. Option C, to wear a mask and gloves for every patient interaction. Option D, to wash hands only after leaving a patient's room. So B is the correct answer. And the last one is 50. In obstetric nursing, what is the Braxton Hicks contraction referred to as? Option A, true labor contraction. Option B, false labor contraction. Option C, contractions that occur after the baby is born. Option D, contraction that occurs only during the first trimester. So B, the false labor contraction is correct.